Hello, my name is Hassan M2 and my co-author is Swami. We are presenting a novel method to quantify bladder neck elevation in colposuspension. The study was self-funded. Reconstructive procedures aim to restore functional and morphological changes. The relationship between the degree of anatomical correction and the functional outcomes continues to be a challenging quandary in urological reconstructive surgery. Stress urinary incontinence and the surgical procedures to correct it exemplify the relationship between the change in morphology and the subsequent change in function. Bladder neck repositioning procedures provide a surgical option in treating female patients with urodynamic stress urinary incontinence. They also address the anatomical and functional abnormality of urethral hypermobility. Elevating and repositioning the bladder neck to a higher intrapelvic position optimizes the pressure transmission during raised intra-abdominal pressure caused by physical activity, thereby preventing stress urinary incontinence, the hypothesis proposed by Horning. Previous studies have proved the success of colposuspension in achieving bladder neck elevation. Pre- and post-operative studies have confirmed that colposuspension reduces bladder neck mobility and restores effective pressure transmission to the proximal urethra. Excessive bladder neck elevation is associated with a significant incidence of voiding dysfunction and de novo detrusor overactivity. Hypothesis. The aim of the study. The need for an optimal level of bladder neck elevation consistent with a successful outcome while minimizing post-operative voiding dysfunction and de novo bladder overactivity has been recognized. There are no simple methods that can be employed to quantify the extent of bladder neck elevation achieved during bladder neck repositioning surgery. As a corollary, it has not been possible to determine the optimum level of bladder neck elevation that maximizes success and minimizes morbidity. Hence, determining the optimum degree of bladder neck elevation during bladder neck repositioning procedures would impact the quality of colposuspension and minimize post-operative voiding dysfunction. Also, the potential elongation of the urethra might reduce the cross-sectional diameter and improve the mucosal seal function of the urethra. Aims of the study. The authors describe a novel technique that enables a precise measurement of the extent of bladder neck elevation achieved while performing open and laparoscopic colposuspension, to determine the feasibility of using a calibrated catheter to measure the degree of bladder neck elevation. The technique is proposed as a starting point for further research that could shed light on this current knowledge gap. Study design, materials and methods. The rationale of the technique. The bladder neck is intimately attached to the anterior vaginal wall. It is elevated along with it when suspending sutures are placed between the anterolateral vaginal wall and the iliopectineal ligament during colposuspension, and also the obturator internus fascia in Vagino-obturator shelf procedure. The elevated bladder neck in turn pulls the catheter balloon resting upon it to a higher position. Thence the stem of the urethral catheter to be drawn into the urethra. The extent of movement of the stem of the catheter corresponds to the extent of bladder neck elevation and can be measured. Technical aspects. The operative steps of colposuspension are well standardized. With the patient in the Lloyd-Davis position, a Foley catheter is introduced into the bladder and the balloon inflated. The catheter is gently tugged down to ensure that the balloon rests on the bladder neck. A vicryl tie or a sterile marker is positioned around the stem of the catheter at the level of the external urethral orifice. While elevating the anterolateral vaginal wall during suture placement and subsequent tying, it was observed that the stem of the catheter, along with the marker tie, is drawn into the urethra. Once the colposuspension sutures are tied, another vicryl tie is placed around the stem of the catheter at the level of the external urethral orifice. The marked catheter is removed at the end of the procedure and replaced with a new catheter for post-operative drainage. The catheter with the vicryl ties is examined to quantify the extent of bladder neck elevation achieved. The measured distance between the base of the catheter balloon and the first marker tie denotes the initial length of the urethra. The distance between the two marker ties quantifies the extent of bladder neck elevation achieved. Results and interpretation. In the 6 patients included in this study, the extent of bladder neck elevation achieved ranged from 2.4 to 3.8 centimeters. The technique demonstrated the feasibility to consistently measure the extent of bladder neck elevation obtained by colposuspension intraoperatively. it is potentially applicable to the alternative procedures that attempt to reposition the bladder neck. Demonstrated a previously unknown factor that colposuspension produced a measurable increase in the anatomical length of the urethra. Previous studies have shown that the anatomical urethral length in women has a statistically significant correlation with the urodynamic parameters of functional urethral length. Discussion. The novel technique has several potential applications. It can be used in a large cohort of patients undergoing bladder neck repositioning surgery. The results correlated with surgical outcomes to determine the optimal extent of bladder neck elevation that is compatible with success while minimizing post-operative voiding dysfunction. The technique brings an element of objectivity to bladder neck repositioning surgery and could be a helpful teaching tool during urological training. The technique could be used in the routine assessment of women with stress urinary incontinence to determine the presence and the extent of urethral hypermobility. Patients with recurrent incontinence following bladder neck repositioning surgery can be assessed by this technique. In conclusion, the long recognized yet unmet need for a simple and reproducible technique that objectively quantifies the extent of bladder neck elevation in colposuspension has been met by the novel technique described.